Good afternoon, my name is Jenna Martinez and I will be assessing active range of motion of his lumbar flexion. So I'm going to go ahead and let my patient stand up. Okay, you're going to be shoulder width apart and put your arms a little bit forward for me, please. So I'm going to have the fulcrum in the center of the iliac crest. The stationary arm will be bisecting the ASIS and the PSIS, so it's going to be a little bit angled in this case. And now the moving arm is going to be in the midline of his trunk. So I'm going to go ahead and tell him to slowly touch the floor as far as you can without pain. Go ahead, slowly. So as he's moving, we're going to move this up a little bit because it is moving upwards. And there it is. Okay, go ahead and relax. So this one reads 70 degrees, which is almost normal because normal range is 60 degrees. So now we're going to go ahead and do that bilaterally, so making him turn around. Do the exact same thing. We're going to start the same way. Okay, go ahead. Okay, and this one reads 60 degrees. So for this clip, we're going to be assessing the anterior rotation glide of the right innominate. So for my patient, I'm going to have him lie down on his left side since we are assessing the right hip. I'm going to let him flex his knee. And so my cranial hand is going to be on the anterior iliac crest and on the ASIS. And this other hand is going to be on the ischial-tuberosity. So we're going to do it anteriorly, so we're going to go ahead and push forward. Okay? And now we're going to test that bilaterally, do the exact same thing, make him turn this way with the same position, except his other leg is going to be bent. Okay? Make sure it's bent a little bit more. Thank you. And then we're going to go ahead and do the same thing anteriorly. And that is your passive range of motion. The end feels we're looking for is it's going to be a firm end feel, and we're going to be looking for the anterior rotators. So for this clip, we're going to be assessing the grade 3 manual muscle test of his lumbar rotation. So go ahead and I'm going to go ahead and have my patient lie down on his back, flex his knees, and have his arms outstretched as so. And then from there, I'm going to make him, I'm going to assess his legs. So from there, I'm going to make him lift his chest up and rotate at the same time. Go ahead. Go whichever side you want. Okay, so now, since we're going to do that bilaterally, he's going to go to the other side. Go ahead. Okay, perfect. Now go ahead and relax your arms. So in this manual muscle test, he used his external obliques, his internal obliques, and in the back of his spine, he used his multifidus, as well as his rotatorus, thoracic longi, and brevis. Now we're going to be assessing special tests, and this is called the squeeze test. We are testing for muscle dysfunction. So I'm going to have my patient lie on his back, have his knees at a 90-degree angle and his hips at a 45-degree angle. And I'm going to go ahead and place 2 fists in between his knees, and I'm going to have him squeeze lightly and then progressively increase his strength. Okay, go ahead. Okay, go ahead and relax. Did you feel any pain in your groin area, or did you hear a pop?
No.
Okay, so you're negative to this test. Any positive indications would include pain in the groin area or a pop in that area. So the sensitivity in this test was a 43 and specificity is 91. So we're going to go ahead and rule in this injury. And there's no way to do this bilaterally, so that's fine. And I think we're done. Yeah. Next we're going to be doing the slump test, and this slump test is designed to add more tension onto the nerve roots by positioning the patient to provoke and subsequently alleviate symptoms. So I'm going to ask my patient to sit upright, Now you're going to slouch a little bit forward, round your shoulders inward, and right there, just have your spine in neutral, and I'm going ahead and put tension towards this. Let me know if you have any pain. Okay, so now we're going to extend your left leg all the way out, normal, and let me know if you have any pain there. No? Louder.
No.
Okay, go ahead and flex your foot. Do you have any pain now?
A little bit.
Okay, so you might have a positive test in this, but we're gonna go ahead and do this bilaterally just to check out any more pain. So same thing here, we're gonna start out just like so. Do you have any pain?
No.
Can you now extend your right leg? Any pain there?
No.
We're gonna hold it a little bit. Go ahead and flex your foot.
A little bit. Ow.
Okay. Go ahead and relax. Okay, so a positive sign would indicate pain down the leg and pain on the sciatic nerve. So he might have a positive sign of this, but we do have a sensitivity of 87, and we have a specificity of 63. So we're gonna go ahead and rule out this injury, and that's everything for this one. So for this video, we're going to be palpating the inguinal ligament, and that is on his anterior section. So I'm going to have my patient lie on his back. Okay, so we're gonna start by palpating the anterior superior iliac spine, which is the ASIS. So is it okay if I do that to you right over here?
Yes.
Okay, so I can feel this hip bone right here, and then right laterally from that is his ASIS. So from there, I'm going to go up a little bit laterally as well, and then I'm going to imagine a line going down to, like, connecting to his pubis bone, and that would be where his inguinal ligament is. And to also help me find that, I'm going to lift up his leg, and it's going to feel like a rubber band like structure, and I can go ahead and feel it right there. So we're going to go ahead and do that bilaterally. So I'm going to go on this side as well. Go ahead and lift up this leg. Okay, and there you go. Go ahead and stand up for me. So everything looks fine there, and that is his inguinal ligament. In this video, we're going to be palpating the quadratus lumborum, which is located on his lumbar spine. So for this one, we are going to have you lay on your chest this time. So go ahead and do that. Okay, so we're gonna start off by palpating the iliac crest. Is that okay if I do that?
Yes.
Okay, so the iliac crest should be back over here. Right, okay. There is his iliac crest. And then I'm going to go down laterally, and then I'm going to be palpating that quadratus lumborum. So just to access it a little bit better, I'm going to ask for my patient to lift up his chest and laterally bend, okay? So I can feel his right side a lot more contracted and the left side is more relaxed. Go ahead and relax. And we're going to do it bilaterally, so I'm going to make him do the other side as well. So go ahead. Okay, there you go. And there is the quadratus lumborum for you. Go ahead and sit straight. We found everything normally here, and that is the whole video for you.